Hey there, Dr. Scott Glocke, upper cervical chiropractor here in Yarmouth, and I wanted to do a tip of the week because we haven't done one in a little while, kind of give you some idea what's going on here in the office. Things are, weather's starting to get a little bit better. People are wanting to do more stuff outside. That usually entails some kind of spinal injury. We've had a lot of people calling in our office with a lot of aches and pains that they haven't had in a while, simply because they're doing activities that they haven't done in a while. Perfect opportunity, come on in, make sure your spine is properly adjusted. We are following all CDC and all the EPA recommendations for cleaning, disinfection. We are abiding by all the rules and regulations of the state, of the governor, with social distancing. If there are times when you want to come into our office and have like a separate appointment, you just have to ask. We've been doing it for the past 2.5 months. Procedures are completely in place that we have very comfortable of taking care of all of our practice members' needs and any of their concerns. And one of the things I want to talk about is with over the last 2.5 months with the SARS-CoV-2 or COVID-19 virus, there's new information coming out all the time on it, and I am a big fan of keeping up to date. And some of the studies that are coming out looking at the virus and individuals that are susceptible to the virus, there's a lot of things coming out looking at specifically obesity, type 2 diabetes, and high blood pressure. There are studies looking at individuals that have one of those three. Your chances of mortality with COVID goes up tenfold, which is an astronomical number. We're looking at lifestyle. So one of the things we want to talk about are strategies that we can implement into our life to reduce not only obesity, but diabetes, type 2 diabetes, and also high blood pressure. This virus have a tendency to attack certain receptors in your body called ACE2 receptors, and some of the medications that are out there attack those receptors also. So it can be a little bit more complicated. So I want, for this tip of the week, I want all of individuals that are watching this video is to change one thing in your diet or your lifestyle that you want to have implement for a healthier lifestyle. Just one thing. Ideally, we want 3 things, but we're going to focus on one because this virus, individuals that are healthy enough to fight off this virus, the symptoms are relatively minor, if at all. But there's a small percentage of the population that have a tendency to respond very negatively to this virus. So the more that we can keep our bodies healthy, the more that we can implement strategies to fight off this virus, and also other viruses are out there. There are millions of different viruses out there. There's thousands of different viruses inside of our bodies that work in conjunction with. The viruses need to be maintained and handled by our immune system, and that's where insulin resistance and sugar comes into play. The sodas, we need to get rid of a lot of the sugars that are in our diets, and I don't mean candy sugar, I mean carbohydrate sugar, like breads, cereals, all of those particular things. We have to eliminate. We got to change our diet. Hopefully with the trend of looking at, while we're in quarantine, we can kind of do some things that we may necessarily have been able to do when we're out and about and working in different fashions. So please pass this tip on. We can do some really cool stuff to help our bodies fight this infection, and so we can get our society back to a better level of health. I appreciate it. If you have questions at the office on what we're doing, that type of stuff, 846-5100. Thanks. Bye.